My dear friends, today we are observing World Asthma Day, and this year we are talking about the theme that is make inhaled therapies accessible to all. We had lots of myths, lots of false perception about inhalers, and I think many of us overcome those misconceptions. Now we are not fearing about inhalational therapies. We are accepting inhalational therapy. So, as we are talking about accessibility of inhalational therapy, two A's are very important to ensure that accessibility. Number one A is availability, and number two A is affordability. And I think we must congratulate our drug regulators because they had included two important inhaler therapy, inhalational drug into national list of essential medicine. One is budesonide, which is a very important inhalational corticosteroid, and another is formoterol, which is having a quicker onset of action along with long duration of action. So often we use the term SMART therapy in asthma patient, that is single maintenance and reliever therapy, and this combination, fixed dose combination of budesonide and formoterol, plays a very important role as a SMART therapy. It can be used as a maintenance therapy, and along with that it could be very much useful as reliever therapy also. As GINA 2025 guideline we are discussing today, it has been released very recently. I got the PDF today only, and one thing I want to highlight here, this time GINA 2025 had made some important points for us who are practicing in the field of allergy and immunology. As I am practicing at Allergy Asthma Treatment Center and Diabetes and Allergy Asthma Therapeutic Specialty Clinic, we use allergen immunotherapy to modify the disease process. And when we are talking about asthma, it is important to highlight a good number of our asthma patients, they are having Th2 phenotype. That means a typical allergic phenotype. And those patients require allergen immunotherapy. Generally, we use subcutaneous immunotherapy, SCIT. Yes, it could be possible to use SLIT, sublingual immunotherapy. But whatever evidences we have, I think subcutaneous immunotherapy we are using for a long time. It is safe, it is effective too. And when we talk about the effectiveness of subcutaneous immunotherapy, I want to highlight two important outcomes. Number one, it reduces the medication score, need of medication. And number two, it also improves the quality of life of asthma patient. Here we want to highlight one thing, because many patients ask us, with this therapy, can you cure my disease? This cure word is very important to address. From the very first day, we need to educate our patient. Cure is not possible for any chronic disease. Whatever we learn in our books, textbooks, our medicine shastra, there is no single disease which is available which can be cured except certain infective disorders like typhoid, like malaria, like tuberculosis, or it could be some cancers that can be cured. The very concept of cure means the disease is inside me, and with certain therapy I am eradicating the disease from my system. It is not possible for all the other chronic disease. So asthma is also like that same. So here, why allergen immunotherapy we are using then? Allergen immunotherapy is the only way to modify the natural course of asthma or any allergic disorder. Here I want to emphasize one point. Many of our patients who is suffering from asthma, they are also having allergic rhinitis, and this phenotype is very crucial. If we can identify them early and if we can diagnose them early and we initiate allergen immunotherapy on top of pharmacotherapy, the effect of allergen immunotherapy is very good in that population. So the allergen immunotherapy can modify the disease process. Generally we talk about two type of system. One is Th2 mediated immune pathway, one is Th1 mediated immune pathway. Normally we have Th1 mediated immune pathway which went back or converted into Th2 mediated immune pathway, and that is why we have allergic manifestation. This allergen immunotherapy is targeting at that level of T mediated reaction, that Th2 mediated reaction, and then again it make the Th2 mediated immune response to Th1 mediated immune response, and that is why we are having less inflammatory cytokines which had been produced by Th2 mediated pathway, like interleukin 4, interleukin 5, and sometimes interleukin 13. So as we are moving towards again going back to our original Th1 mediated pathway, so we are getting benefits, and that benefits translate into reduction in the number of medication. Sometimes we had seen the mean cumulative dose of inhalational corticosteroid that also being reduced. But one important point we need to remember while taking allergen immunotherapy: it is not a short-term process, it is a long-term process, long-term relationship between me and my patient, because the current guidelines tells us this allergen immunotherapy should be taken for at least 3 years to 5 years. And most importantly, the first year, when we are building up phase, building up the immune response to allergen immunotherapy, this first year is very crucial, because in that first year we will not get any clinically perceivable improvement. So after 1 year we got certain clinically perceivable responses, and according to that we try to reduce the dose of the drugs. But again I want to highlight, it is not a cure solution to allergic disorders like asthma or allergic rhinitis. We are going to control your disease process in a better way. Whatever chronic therapy we are managing, our goal is two. One, you should have a good quality of life, and number two, you should have the quantity of life also the same. Like if you don't have the disease, then also how much life you want or you should live. With the disease also, you also live in the same duration. So this is the take-home message for us. We should provide our patient a good quality of life and good quantity of life. Take your inhaler properly. Do not get fear about inhaler, and if it is really indicated, allergen immunotherapy is very important. It gives us immensely benefit in terms of reduction of medication score, improvement of quality of life. Allergen immunotherapy, the basic issue is we need to choose the right patient. We should choose the right allergen and the standardized allergen. That is again very important. And one very important issue often we see, many of our patient comes to us with a skin prick test report or allergy report, allergy profile report, and tell, treat us doctor. We should not treat the report, we should treat our patient. And that is why even we do skin prick test, after that all we need to take the second history, and then we need to decide about allergen immunotherapy. So thank you all, stay healthy and breathe healthy.